Welcome everybody. Happy Tuesday. We're talking about effects of full moon on the human body and any astral bodies in general, but especially full moon, because that is one of the astral bodies is closest to planet Earth. And positively, yes, if you're in a positive, good place and vibration, it will amplify it. So just keep in mind, you have full moon that basically illuminates everything that you have in your subconscious. Whether you have bad, whether you have good, all your weaknesses and all your strength, it's illuminated. Now the question is, how do you use that? If you are a conscious person and aware person, when you have this illuminated, even if it's negative, you will take that and you will take it as a homework and start working on it. Correct? Instead of being judgmental, saying, oh my God, she did this to me. These people are crazy. I'm going crazy. You would say, okay, I am actually now seeing what is happening with my internal being. You know, if you feel uncomfortable, if you feel fearful or anxious or anything, fearful, whatever you feel, that means moon is showing what needs to be taken care of. You see? And the same with positive. If you have it, be grateful that you're positive, be happy that you're positive, and amplify it even more. It's easier to amplify. So if you have positive emotions in your subconscious and then full moon comes, it amplifies and makes it even more palpable and tangible. Celebrate that. You see? By doing that, of course, in the same time, you're going to have something negative going on, but you will, by celebrating positive, you will kind of suppress negative or heal negative, you should say. You know? People are still coming in. Everybody, very, very good to see you all. Janet, Herbert, Gina, Kevin. Happy Tuesday, everybody. So today, last time, for those who for those who missed last week, we were talking about heart. So you guys have to just go back and listen to the recording or watch the recording. We also did some meditation on the heart. I taught you guys certain techniques in meditation. So we're going to be going through each organ or each system in our body. So last week was heart chakra, organ, heart. And today, this week, we will be talking about kidneys. Kidneys. What is the physical portion and functional kidneys in our body? What is the spiritual meaning of kidneys? What kind of energy kidneys carry and how to enhance it? We're going to talk about that as well. People still coming in. I'm going to be letting people in. I probably will repeat myself one more time because people still coming in. Welcome, everybody. Very, very good to see you. Anastasia, you look beautiful. Look at this face. Innocent, beautiful face. Beautiful energy. Amazing. So let's just go back a little bit. Last week we did heart meditation. You guys practiced that heart meditation of the week and that space inside of your chest. Did you guys do that? You want to share with that a little bit? You want to tell me what happened?
I did.
Okay.
It was really fun. But I also did start to do push-ups.
Without breathing?
Yes.
Good. Yes, exactly. Yes. So you basically took the whole lesson and then you practiced it. That's amazing.
Yep.
Yes. That is how you
motivated.
straighten your heart muscle when you push up on an exhale. It's also called Wim Hof technique. Excellent. But what about awareness when you with someone, communicating with someone, and someone is pushing your buttons. Whose buttons were pushed? Say yes, mine last week. How many times your buttons were pushed last week?
Every day.
Every day, because we're humans. That's what we came for, to get our buttons pushed. But how many of you went back to that space in your cage, behind the sternum, behind your chest bone, and then felt the space when it happened? Did you remember doing that?
I did.
Good for you. Good for you. So that is very good way of protecting your energy, number one. Number two, protecting your heart and practicing compassion to yourself first, to yourself. Because every time when someone pushes your buttons, and every time when we react to it, and you react to it, you actually not practicing compassion. See? So it's good to remember. And we're gonna go back because some of you were not here last week. I really, really suggest you to go back to the recording and listen and then practice. It's a really, really good way of healing yourself. Now, today, we're gonna talk about other very important organ called kidneys. Let's talk about kidneys. Kidneys is one of the most important detoxifying organs in our body. We have liver and we have kidneys. If your liver and kidneys do not work, people die within 24 hours immediately. That's how bad we depend on kidneys. Kidneys remove toxins from the blood. So all the toxins that the blood collects while it is running through your organs. And remember, it goes in the capillaries and removes every removed toxin from the cell or trapped in the cell gets dumped into your bloodstream. That blood goes through the kidney filtration. And the kidneys have to filter it. If you guys have pools in your backyard, some of you probably understand how filtration works. The fluid goes in, you must have some kind of pressure to push the fluid in, and then it goes through filtration system, and then it comes out clean and crystal clear. So it's basically the same concept, just to simplify it. Of course, it's not as simple. It's much more complicated, but it is how it works. Now, when we go to the doctor, the regular doctors, like a primary care doctors, and when we don't even ask about kidneys, we just say, hi, I'm here for my annual. And the doctor checks, they do your blood test, they do your urine test. The blood test is to see what's your urine function, and not urine function, but kidney function is, your filtration system, so to speak. How's it working? It's called creatinine. It's called GFR. So if you have access to your metabolic profile, blood metabolic profile, you will see those numbers and you're going to be able to see the reflection how your kidneys are working, right? Your doctor probably also asks you to pee in a cup. And we send urine for urinalysis and urine culture. Why would we do that? So besides checking the filtration in the blood, through urine, we actually can see if your kidneys are filtrating too much of a protein. Not filtrating, I mean, it actually, you have a lot of protein that just being dumped into the urine. And that protein, that means your body is losing protein. The blood test called either complete metabolic profile. In the blood test that we've done on you in our office, it's usually complete metabolic profile. But the blood test that is done in other offices. It could be just basic metabolic profile. Okay. So the difference between basic and complete metabolic profile is complete has liver function. Basic metabolic profile does not have liver function. It has only kidney function. Okay. So the urine actually can show if you're dumping protein from your body. Thus, you're losing protein. Thus, there's something going on. It could be any autoimmune disease. It could be kidney disease. It could be some other problems where your muscles are being destroyed. Whatever. You also could be dumping certain things like creatinine. And that happens in a healthy body. It happens if you are someone who's going through very, very strenuous exercise, when you're using your muscle to the point that you're just dumping that creatinine, a lot of creatinine. That means you are destroying a lot of muscle in your body. And another thing that we can catch on the urine test, if you have sugar, you may not be diagnosed with diabetes, but if you're dumping sugar, that's another sign that something is not right with your filtration. Sometimes people may have bleeding or may have a little bit of red blood in the urine and they freak out because doctors say, well, we have to rule out cancer. But before cancer, a lot of times bleeding, the most common cause is either infection. If you're a menopausal woman, it could be menopause because everything becomes dry, or it could be a kidney stone or bladder stone or urethral stone. That is the most common one. But of course, if there is any blood, especially frank blood, a lot of blood in the urine, then of course you must not ignore. Like all these things, why am I telling it to you? Why I'm mentioning these things? To explain to you that these tests are important. That is the information this test carries. So you must not ignore it, but at the same time, you must not go crazy about it. The most important thing that you have to remember is awareness is the key. If you are aware, then you can take certain steps and make certain decisions where you're going to help yourself, to prevent certain conditions. So that is the physical part. I'm not going to talk about like kidney failures and all that. I'm not going to talk about it. Why? Because kidney failure it's a very end result of being out of balance with your body for a long period of time. We're going to talk about, just like I said, physiology. When you go to the doctor's office and they do your blood test and urine test, what to look for, and be aware of your function. Okay? And if it's missed, you're going to be able to catch it. Doctors are humans as well. The doctors may make mistakes. So all of us have to be responsible for our health. Okay? So this is basically educational type of material that I'm giving you, so you would be more educated, more connected to your body. Now, a lot of times girls experience a little bit of UTI-like symptoms, and they go, oh, it's just UTI. It's a simple UTI. I'm going to drink some cranberry juice. I'm going to go and get some Azo. I'm going to take something over the counter, and they ignore it. In reality, what happens is you have that bacteria sitting in your bladder, slowly growing there, and you just getting a little relief, but you're not really completely getting rid of it. And then at some point, especially if you are someone who holds her urine long and doesn't go to the bathroom often, there is a phenomena called reflux or reflex. In the reflux, where the flux of urine, instead of going down because you're holding, the pressure in the bladder is so tight now, it has nowhere to go, then that urine from the bladder starts moving into the kidneys. And that's how people develop kidney infection. Kidney infection is nothing to, it's very, very serious condition. Do not kid with that. Kidney
Goodness,
infections sometimes can lead to losing kidney. I have at least 2 patients who end up in ICU, and one of them actually lost her kidney due to urosepsis. Please, please, if anything, do not ignore any symptoms of UTI. Yes, drink plenty water. Natural way to flush it is to drink, or prevent is to take not cranberry juice, but cranberry extract. And I'm gonna explain what it does it do to urinary tract. And always when you go and see a doctor, if you're not my patient, please ask your doctor to check for culture, not just urine sample, for urinalysis. I hope you guys taking notes for this, because if you have just urinalysis will show, okay, you have some bacteria, a few bacteria or lots of bacteria, moderate amount of bacteria, but it really doesn't tell you what type of bacteria you have there. And then usually doctors don't have time. It's sometimes insurances may not cover, although very rarely, but what if? They don't send it to your urine culture to the lab. You take your antibiotic, you kind of feel better, but then a couple of weeks later, it feels like it's back. So what happened is that bacteria probably wasn't as sensitive to that particular antibiotics. You received it, you kind of killed it, but at the same time, the survivors of that treatment, the remainder amount of bacteria that survived this antibiotic attack, comes back stronger. And now we're dealing with mini superbug. And if you're going to continue shooting antibiotics, you're going to keep creating the superbug that then is going to be very, very difficult to treat. That's why every patient who comes to my office, we do send urine culture. Why? Because on the culture, when they put it on the Petri dish and keep it for a couple of days, they will check, and if there is a certain bacteria, they check for sensitivity to certain antibiotics. And I receive report. This antibiotic is moderately or intermediately sensitive to nitrofurantoin. This antibiotic, very sensitive to Bactrim, not sensitive for Cipro. I'm just giving an example. Then I know if I gave this patient Cipro and it's not sensitive, that patient needs to go on different antibiotic. You see how it works? And in that case, you will definitely prevent the superbug formation. Now, that is for women. Women get UTIs and urinary tract infections, and they higher risk for kidney infections compared to men. But the older we get, men also are possibly the increasing risk, because with the prostate, with the stream of the urine, with the capacity of distension of the bladder, all these factors affect your ability to protect yourself from urinary tract infection. Women are very prone to have urinary tract infection, but when women hit menopause, even more. Why? When we menstruate, we still have estrogen that protects our bladder, our vagina. We have all these factors that protecting, and you basically, okay, but then once you hit menopause, all these protective factors start dying off, going down, and then you become more susceptible. Now let's talk about how cranberry works, and why not cranberry juice, but cranberry extract. So when let's say you had sex, if you're a woman, for example, you had sex, and that little bacteria crawls from the vagina during sex, because we're not sterile, into the urinary tract, right? And it has a little hook. And if this is the wall of the bladder, it hooks on the wall of the bladder and sits there and starts multiplying. Next day, you go, I have pain. We call it UTI. Now, when you drink and pee and wash yourself before and after, you will decrease that risk of getting it. But let's say you did that all and you still receive that bacteria in your bladder. So how do you prevent this hook of bacteria with that hook hooking on the wall of the bladder? How do you do that? Well, cranberry extract. Cranberry has this ability to create protective layer. It creates nice protective layer. If this is the room and this is the bladder, it's almost like a plastic sheet. So when bacteria with a little hook comes in and just slides out, there's no way for it to hook. But one thing that you have to remember, when you buy cranberry pills, or even if you don't buy it, just when you're in the store, open the cranberry, like in the vitamin shop, and read instructions. And it says 1 or 2 capsules twice or 3 times a day. Again, remember, you have to develop protective layer in the bladder, right? In order for you to develop that protective layer, you're not supposed to have any movements in the bladder, meaning that you're not supposed to pee at least for 6 hours to build that layer. Thus, you have to take it at night before going to bed. Because if you're going to take it during the day, you're constantly peeing it out, especially if you drink a lot of water. So the person or whoever is producing it, they don't even fucking know, I'm sorry for my language, how this thing works. You see? And a lot of doctors also don't even pay attention to it. And then this is where you hear patients saying, I took my cranberry pills and I still got it. Well, how did you take it? 3 times a day. Dun, 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 dun. All right. So just keep in mind. Yeah, these are little tricks that if you remember how to, like your body works and all these little tricks, this is how you're going to prevent. And if you're going to take cranberry pills, cranberry extract every night, not only you're going to prevent urinary tract infection, not only you're going to prevent kidney infection and kidney failure, you're also going to boost your immune system. And for women, it's also good for vaginal health, for your microbiome. It's an amazing thing. For men who have prostate enlargement, problems with prostates and so forth, also very, very good way of controlling it. Okay. Now, enough of this medical stuff. Now let's talk about spiritual stuff. But before we jump into spiritual, we're going to talk about how kidneys are viewed in Ayurvedic medicine, in Chinese medicine, in Oriental medicine, in ancient medicine in general. It's not only an organ, it's meridian. Kidneys are responsible for certain functions in your body, according to Chinese medicine, certain abilities of your body. For example, it's responsible for water element, right? Water element is your emotions. We were just talking about full moon and emotions. Thus, it's also responsible for your creativity. So in Chinese medicine, they say if your kidneys are affected, if the meridian in kidneys are affected, then creativity is kind of blocked. Creativity, easygoingness, that type of abilities kind of blocked if someone has kidney problems. Okay. So water, of course, we said emotions, creativity. What else? It also responsible for conception, for ovulation and conception. You would think kidneys, according to Chinese medicine, from the meridian that goes through the kidney, if someone has fertility problems, we always say, make sure that you are stimulating those meridians, whether it's massage, whether it is any kind of activities like yoga, meditation, breath work. Every time when we do diaphragmatic breath work, we actually working on that kidney meridian as well. And the most important organ, endocrine organ that's sitting on top of kidneys, adrenals. Adrenals are responsible for your stress response. And then if you're out of balance with that, with your emotions, then what happens? Hormonal imbalance, your cortisol, your inflammation. You see how it's all connected? I'm loving it. It's beautiful. And according to Chinese and Oriental medicine in general, all these organs, they have openings in the certain areas. So if I have kidney meridian, the opening of kidney meridian is in the ear. So the opening is in the ear. So waking up in the morning is one of the rituals that a lot of martial arts people perform and do. They wake up, and it's really good, by the way, for especially for men, by the way, guys, those who are listening. When you wake up in the morning, you really have to massage your ears. Everybody has to, but it's especially good for yang energy. We all have yang and yin and yang, but for men, just massage as soon as you wake up in the morning. That is something that increases vitality and defies aging. Yes, kidney meridian is responsible for aging as well. If you have lush hair on your head, that is impeccable kidney meridian, meaning that your meridian is just booming and blooming and beautifully working. If you are losing hair, again, when you go to Chinese medicine doctor, they put needles in that particular area to help you with hair. You see? It also affects your bone marrow. It affects your brain. What else? And of course, because of adrenals, it affects your willpower. That is from Chinese standpoint. Okay, so I've been talking the past half hour now. If you guys have any questions, let's just stop here for now. So far, if you have any questions, ask me, and then we're gonna move on how to support our kidneys. Any questions, guys?
How long should we massage our ears in the morning?
At least 1 or 2 minutes. And by the way, guys, for women and men, ears and your inguinal area, you know, where you have your groin area, also vigorously massage that area as well, for men and women, the first thing in the morning. And by the way, if you watched all these martial arts like championships in Asia, before they start sparring, they actually sit down and they really vigorously massage their ears, nose and ears, so to boost that virility and vitality and that willpower, so they could just go and conquer. Anybody else? Any other questions?
Yes, I have a question about cysts in the kidney.
Yes.
How do you get rid of those?
Yeah, we're going to talk about them. Cyst in the kidney usually happens when filtration in that particular area gets affected, and then we call it glomerula, which is the unit of filtration, dies off, and the empty space appears. Basically, you develop empty space, and then in empty space, the body just fills it up with fluid, and that's what we call cyst. Depends on the size of the cyst. You're gonna have to detox, and this is the good time to detox right now, springtime. I'd say it's gotten warmer now, so I guess it's now. Bitter herbs are the best, and especially dandelion greens. I talk about dandelion greens a lot, but especially for kidney function, they flush kidney, liver, and colon like no tomorrow. Like no tomorrow. It's amazing. So you get your dandelion, you just either buy it or get it from your backyard. You guys just get like maybe 5-6 leaves of big dandelion leaves. I use NutriBullet. I put it there. I peel 1 lemon, drop it there, put lots of water, and then you blend it and then strain it and drink that water instead of water. You can drink that all day long. If you like some ginger, you can put some ginger for the taste. If you like some, I don't know, mint, you can put some mint, because mint is also cools down kidneys. and you drink that water all day long. By the way, when you make that, make sure that you're not like prepping it. So people do it and then leave it in the refrigerator and keep it there for a day or two. No, it has to be
Right.
freshly made and drank right there. Okay, this is when you're going to get benefits of it. And within a couple of weeks, I'd say within a month, the cyst should either shrink or go away. Again, depends on the size and depends what's in there. Okay, but it's not only a cyst. You're going to see your skin is going to glow. Everybody, just do that. This is the time to do it. Your skin is going to glow. It's going to give you that vitality because you're flushing your kidneys. You're literally going to feel high, especially if you just went for a workout or some kind of either walk or any kind of workout.
Physical
Came back
activity.
and you drink that. It's amazing. It's amazing to have this.
Okay,
Yeah, so try it.
thank you.
You're welcome. Anything else? Ask
Hey,
me
can you
anything.
hear me? Hey, this is Janet. Thank you for the great information. So I can't find dandelions anywhere. Like where can, I mean, I live in Charlotte area, Charlotte, North Carolina.
Really?
I can't find them at Sprout.
They don't grow in your backyard?
Oh, those kind of dandelions?
Yeah.
Really?
Yes.
My
As long as you're
neighbor
not
has
spraying
them.
them with the you know these pesticides, as long as they're growing in your backyard and you didn't spraying any chemicals on it.
Oh, okay.
Dandelion, by the way, guys, this guy, Dandelion, survived 2 ice ages. 2 ice ages. Can you believe that? It knows how to survive.
Wow.
It has all these adaptogens in it.
I have
And
them
this is
growing
the
in my
time to do
backyard.
it. Huh?
I have dandelions growing in my backyard
Enjoy them.
and
As
wild
long as they-
lettuce and wild lettuce as well.
Oh,
As long as they're not sprayed by chemicals, guys, use it. This is the season. The best season to do it. Yeah.
Should we, do-
I just was gonna make another comment. My daughter went away to college and she got a kidney disease and had the creatine. All that was way off just from walking, miles across campus. And she does the azo thing because she gets the frequent UTIs. So it seems to me like probably she's got something going on.
Exactly.
You know?
Exactly.
Yeah.
Don't play with that. And azo is just a painkiller. It does not help you. Instead, she should be preventing it.
Okay.
Now you know how.
Yes, and I don't know what's going on with my female reproductive, but I've been in menopause for over 10 years. And I think it was from taking too many baths. I do not recommend that because you're taking a bath in dirty water and it will cause a vaginal bacteria.
That is absolutely true, especially if you're
And-
using harsh soaps. It's absolutely true.
Yes. And I am
Yes.
very, very, very sensitive to fragrances, period. But I have been working on getting rid of this. I've had it for over a year. I've done 1 dose of medicine through my gynecologist, and I'm having to do a 2nd dose because it was so bad.
Yes. Yes, you have to
Because-
talk to a gynecologist and they might offer you, if you qualify, to use estrogen cream to prevent those things from happening.
Actually, I can't due to the fact I have fatty liver disease.
No, topical, not oral.
Oh, topical. Well, they don't want me around estrogen cream at all.
Well,
Mm.
But
ask
I-
about topical because if you have this frequent thing going on, talk to them and a suggestion. But by the way, for fatty liver, dandelion is the king.
Yes, I found this traditional medicinals. Of course, it is at Walmart, but it's organic roasted dandelion root. It's
Yes.
a detox and digestion.
That is
And-
it's a very good way to do it on the daily basis. Great. I love this particular tea. But right now, during this season, the spring is starting,
Mhm.
dandelion, your body will wake up. We are doing detox. We're detoxifying ourselves, spring cleaning with the green green, leafy, live things. You're drinking
right.
not just vitamins, you're drinking, it's like fountain of life.
Right. I
Good.
also have this mushroom immune blend powder that's got maitake mushrooms, red reishi, and lion's mane in it.
That's
And an
perfect.
andrographis powder. But
Yeah.
I took some cranberries, some oranges, some lemons, some limes, and some habaneros and jalapenos, and I juiced them through my juicer, and it just gives me about a pint jar, and I take a drink of that every single morning,
Good.
and it's got a lot of vitamin. Oh yeah, it's pretty warm, very
Yes.
spicy with the
Yes.
jalapeno and habaneros.
Well,
But
with the jalapeno, it's not for everybody. That's why I say I'd rather just use ginger for some people.
yes,
So
it has ginger, it has turmeric root,
yeah,
and in it also, as well as all of the lemon, lime, and orange, cranberries. I usually put rosemary, thyme, oregano, and all that in there, but I didn't have. I'm growing that stuff right now, and there's not
good,
enough to
good,
pick.
good. All right, so next week we're going to be talking about liver and we're going to address more of those herbs and everything. But today, let's just focus on kidneys. I really want you to understand how kidneys, your bladder and kidneys, vagina and, prostate, and how it's all connected and how important it is now not to just do not ignore. Please do not ignore. Okay. Now, any other questions before we start meditating on our kidneys?
Yes.
Yes.
This particular dandelion drink, would it be most beneficial like first thing in the morning, or just doesn't matter?
Dandelion drink, green juice. What I do it in the morning. And the way I do it, I drink the whole thing, like 1 liter. I just drink in one big gulp almost immediately. So that helps like a good enema for me. Too much information, I know, but it's such a cleansing thing that it's absolutely amazing.
Yeah, well, I should be pretty cleansed. I just had a colonoscopy. I have to have a colonoscopy every 5 years.
Yeah.
Unfortunately, my father had colon cancer.
Yeah. All right. So any other questions before we move on to meditation and breath work?
Nope. I don't have any other questions myself.
Okay. So try to find a nice, comfortable place where you can just sit down, and we're going to work on the space in our body. We're going to focus on the space in our body where the kidneys are. Anybody who does not know where the kidneys are located, say yes, me. I would show you. I would show you anyway, but just I want to know that everybody knows where kidneys are located. Okay. So kidneys, if you feel your lower ribs, the very, very lower ribs, this is where your kidneys are sitting. Okay. So, and they are not just in the back, they inside of that space between your front and back. So somewhere in that space, they're sitting on both sides. And on top of those kidneys, you have adrenals. That is your emergency battery. Emergency battery. Okay, your cortisol, all these life or death type of things, like your responses to your body. Okay. So now let's just sit down, close your eyes, and we will start breathing first because we need to bring oxygen into our body. Sit up straight, but relaxed. Completely straight, shoulders are relaxed, spine is relaxed, jaw is relaxed. Breathing, normal breathing first. And now we're going to start moving our diaphragm. Diaphragmatic breathing goes from The belly, remember, you inhale and the belly becomes like a balloon. We expand the belly and then you exhale. You can do it through your nose. You can do it through your mouth. It really doesn't matter, because what we're doing right now, we're mechanically massaging your internal organs, including your kidneys. Okay, move that diaphragm. Breathe in, breathe out. Find your own pace. It doesn't have to be fast. Breathe in, breathe out. It has to be rhythmical, deep massage with the belly and bringing oxygen. You're not only massaging, you're squeezing. Every time when you exhale, you're squeezing your muscles in your abdomen. You're squeezing these internal organs. And then you're inhaling and you're bringing oxygen and you're bringing blood flow into your abdominal area, into the kidneys and other organs as well. Just keep breathing. Let's just bring that life in. Very good. Very good. Now we know how to enhance this beautiful two kidneys, two organs sitting there and detoxifying us endlessly. Now we know that. Just keep breathing and massaging and say thank you. Thank you for serving me for so many years. Thank you for removing all the toxins from my body. Thank you for serving me for such a long time and loving me. Thank you. Just be grateful. Okay. And now exhale and start breathing normal, regular, comfortable breaths. And pay attention into that inside abdominal area, that space inside of your abdomen, the whole space. Imagine if it's empty, if it's hollow, there's nothing in there. Just pay attention to that space and feel it. Feel the space in your abdomen. You must feel good when you feel that space. Don't forget to breathe. It has to be comfortable. It has to feel good. Feel the space. And now feel the space around your abdomen and your body, your back, the whole entire abdominal and your back muscles. That space that occupies around your body. Just feel it. Feel it. Don't visualize it. Feel the space. Go back in space in your abdomen and feel it. Feel it. Oh, it feels so good. Now feel the space around your torso again. Very good. Now move your attention into your chest. Your chest, between your chest bone and your shoulder blades. There's a space. It's empty. Empty space. Feel it. Feel the space. Breathe. Don't forget to breathe. Feel the space around your chest. Feel it. Just feel. That is your heart. Now connect your chest space and your abdominal space together. Now the whole torso is empty. Feel the space from the lower abdomen all the way to your upper chest. It's one big space. Feel it and breathe. Don't forget to bring oxygen into that space and feel. Now to feel the space around that torso of yours, everywhere around you. Just feel. Now let's go into your neck. Inside of your neck, there's an empty space. Feel it. Feel it. Breathe. Breathe and feel it. Good. Now there's a space in your head. Empty space in your skull. Oh, that feels so good. Empty space in your skull. Now the whole space between the tip of your skull inside, all the way down to the bottom of your lower abdomen. The whole space, just feel it. Your abdomen, your chest, the space in your neck, and space in your head. It's one big space. Feel it. Breathe. Bring the oxygen in there and feel. Just sit in that space. Now, feel the space around your body where you're sitting in the room. Feel the space around your body, occupying the whole entire room. Feel it. That was good. Don't forget to breathe and send oxygen, just oxygen, and feel the space. You don't have to visualize anything. All you have to do is feel. Feel. Feel the space in the room. Feel the space inside of your body. Just feel everywhere. Feel the space. Focus on the space and feel it. Wherever your attention goes, just feel it. Very good. Now, slowly, come back to your senses and open your eyes. And with your eyes open, feel the space in the room right now. And with your eyes open, feel your body and feel the space inside of your body. As it's hollow, it's empty. Feel that. What I want you to do now, memorize this feeling and train yourself to get into the feeling when you're sitting anywhere, whether you're sitting at home by yourself, whether you are talking to someone and listening to someone, going into that empty space of your being inside of your body, and then feeling the space around yourself while listening to someone's conversation, story, observing something. Just memorize that and try to do that during the day, every day, the next 7 days until next Tuesday. And see what happens. See how people will start acting around you. Do not judge anything. Just feel the space. By doing so, what you're creating very powerful magnetic whole in your body. And by working with your heart, which is behind the chest, and your abdomen and kidneys, which is in your abdomen, you are becoming very, very powerful magnet. Your magnetic field, your aura becomes so strong that people will feel it. Just observe the world through that feeling, through that state. Play with that. And see how, if you're going to do this for, let's say, 6 weeks every day, it becomes automatic. You're not going to have any anxiety. You're not going to have any anger. You're not going to have that. Feel the space. And that is meditation for the kidneys and your vitality. Any comments, any questions, anything that anybody wants to say here? Let me know. Any questions before we wrap it up?
There's a set of crystals known as the Vogel crystals. They are cut very precisely and they're used for healing. Can those sort of enhance meditation?
Absolutely. Yeah, absolutely. Sound, crystals,
Also.
yeah, will enhance it. Absolutely.
We need all the tools we can find these days, right?
Yep. Yep. But I'm teaching those tools that even if you don't have crystal, even if you don't have
Right.
sound, you have your body. So then you can always just go and just use that tool and reset yourself. And there you go. You're ready to conquer the world.
Great. Thank you, thank you, thank you.
Thank you, everybody. It was amazing. And if you have any other questions, you can always submit them or prepare them for next time, next week. And we will be seeing you next week and talking about liver.
Really.
Liver, we're going to talk about anger. We're going to talk about how to not control anger, how to digest anger, frustration, anger, hate, which is the worst manifestation of anger. So I'm going to teach you how to work on that and direct that, digest that. Okay, drink your
Thank
dandelion,
you.
guys. Breathe, feel the space. Bless your kidneys and heart, and I'll see you next week. Love you all.
Have a
Thank you.
wonderful week.
Thank you very much.
Thank you for showing up. Thanks. Bye.